September is Prostate Cancer Awareness Month. According to the American Cancer Society, if prostate cancer is detected early and before the cancer spreads, patients have a nearly 100% chance of survival after 5 years. So Texas Oncology radiation oncologist Jessamy Boyd joins me to talk about how the importance of early detection makes such a huge difference. Good morning.
Good morning. Thank you for
It's
having
so
me
great
here
to have
today.
you here. So who is at risk of developing prostate cancer?
So prostate cancer is a disease that men develop as they age. So most men who are diagnosed with prostate cancer are diagnosed over the age of 65, but the risk really starts to go up over about the age of 50. Family history plays a role as well. So men who have a father or a brother who have been diagnosed with prostate cancer also have twice as likely a risk of developing it during their lifetime. Racial factors play a role too. So for reasons we don't completely understand, African American men have a 60% more likely chance of developing prostate cancer. There's also some genetic factors that play a role as well. There are cancer genes, the BRCA1, the BRCA2 gene, that can predispose families for breast cancer as well as prostate cancer. And then there's also a familial form of colorectal cancer called Lynch syndrome, and that also increases the risk of prostate cancer.
Well, we talk about early detection. What are some of the signs and symptoms that men should look for?
Well, I think the most important thing men need to know is that early stage prostate cancer is asymptomatic, and that's important to know because that's really when we want to detect the disease. That said, some of the symptoms that people need to be aware of are changes in the urinary function. That can be things like difficulty urinating. Changes in the erectile function can also be a red flag that men need to see their doctor. And then finally, in its more advanced stages, prostate cancer can have some more significant symptoms, things like bone pain or neurological changes.
So we talked about it a moment ago, the survival rate. Is that the main reason it's so important to catch it early? Are there other reasons?
There are other reasons. One of the main ones is that prostate cancer is common. It is the second most common cancer diagnosed in men after skin cancer. It's also the second leading cause of cancer death in American men, so it's so important that it's well known. But I think you made the most important point, and that is that prostate cancer is important to detect because it is so curable in its early stages. And so that's really our goal, is to catch it early.
So what are the screening guidelines?
It's very individualized. So men need to have a conversation with their own individual physician. In general, prostate cancer screening should begin at about age 50 for most men. For African American men and men who have a family history, it may begin even earlier at 45. And for very high-risk individuals, it may need to have screening around age 40. So it's just an individual discussion men should have with their doctor.
Obviously, really important, as you said, and early detection is so critical. So how can viewers learn more about risk factors, symptoms, and screening?
Yes, a good resource is TexasOncology.com. You can go there to find great resources about prostate cancer detection and a wide array of prostate cancer treatment. When you're there, you can also see some of the resources that we use to care for our whole patients as oncologists, and that includes things like genetic testing, financial counseling, nutrition information, and support groups.
Thanks so much for joining us this morning. Great information for our viewers.
Thanks. It was good to talk to you.
Go to TexasOncology.com for more information. Paige?